Good afternoon, everybody. Welcome. My name is Jocelyn, and I am the Manager of Special Projects at the Center for Aging and Excellence in Longevity. SEAL has been dedicated to building a future that promotes health and longevity across the lifespan. And these webinars have been an opportunity for us to allow students and healthcare professionals and professionals in the field to talk about all the different pieces of longevity and how they fit together. Our guest today is one of those people that's fitting the puzzle together. I'm very excited to introduce Dr. Kevin Valadares. He wears quite a few hats, and he comes to us today from the University of Southern Indiana. He is a professor. He is the chair of the Bachelor of Science in Health and Informatics and Information Management and the Masters of Health Administration program. His research is actually the topic of today's discussion, which is advanced care planning. So without further ado, I introduce to you guys Dr. Kevin Valadares.
Thank you so much, Jocelyn and Michelle. And I'm really glad to be here on Zoom. And as Jocelyn said in an introduction, so I'm coming to you from Evansville, Indiana, sort of in the middle of the country where I live. We are very close to Illinois and Kentucky. And so, but I'm glad to be sharing some of the work we've been doing here. I work at the University of Southern Indiana, but also, and my background is in healthcare administration and healthcare ethics. So I'd like to share a topic that I've been working in, really had the honor of working in with communities, with health systems. And it's a personal topic, which is the notion of advanced care planning. And so I'm going to start sharing my screen. I've got actually have a few videos to show as well, because we all like videos. Advanced care planning, what matters most. And of course, my two dogs, Max and Joe, who usually would accompany because they believe all Zoom sessions are for them. But I'm in my office right now because they would be in the middle of the Zoom. So they've probably heard this too long, which is why they're sleeping on the floor right now at home. Besides being a faculty member at our university, I'm also, in my title, co-investigator of a GWEP. And I'm going to talk a little bit about this GWEP. It stands for the very bottom, a Geriatrics Workforce Enhancement Program. It's a 5-year grant that our university was awarded for the second time. It runs from 2024 to 2029. And I've been fortunate to be part of it. This is where we've done a bulk of our advanced care planning work. And so I'll share some of that as we go through this. And I would ask all of you to think about yourselves, think about your family members. My guess is that you have been caregivers, some of you, maybe perhaps are currently caregiving for a family member or friend. And so I'd like you to think about you and your family as we're discussing this. So advanced care planning, or ACP, it is a process. And these 3 bullet points really sort of summarize what it is. It's important for all adults. And the second bullet point is the key. It involves reflection and sharing, specifically about future healthcare decisions. What might you want if you are not in a position to speak for yourself? What don't you want? And the time for this is now. And it is important for a variety of reasons. I work with undergraduate and graduate students, and we start talking about advanced care planning with them when they are in their early 20s, especially if they have an accident. But it could be an accident or a serious illness, and you couldn't make decisions for yourself. So it's important. On the right-hand side of this slide is a nice diagram that really sort of talks about the evolution of advanced care planning. It is a progression throughout life. as one is healthy and becomes less healthy. So it's not only about end of life decisions. In fact, one of the most important, in my mind, the most important part of the ACP process is naming a surrogate decision maker, naming a proxy or a representative, and we'll talk a little bit about that. So it looks at current issues, but also planning for the future, knowing that we can't plan for everything. We don't know what's going to happen. So why is advanced care planning so hard? And can we make it easier? Um, well, from a variety of perspectives, um, it is a issue of time, and especially as we think about our physicians, perhaps those we have relationships with, not having the time, or we don't have the time to discuss it with our physicians. And it's quite honestly something daunting that individuals and families really don't want to discuss, at least some don't. But my guess is that all of you, either personally or through family members or through friends, have heard stories, have experienced um, some negative parts of the healthcare system, and perhaps family or friends who have had a bad experience in either the illness process or maybe even the dying process. So we all know the importance of it. I'm going to introduce you some tools that some of you might be familiar with, but one tool in particular for all of you that I'll invite you to check out. You can check it out immediately. It's a free tool, and it's something that we're using quite a bit, and I've used it personally in my advanced care planning process. So why is it important? It's important for a number of reasons that were addressed a little bit earlier. But for individuals who are experiencing illnesses, serious illnesses, it's been proven through a number of the studies that are listed below. Actually, this is just a handful of them. Improve patient satisfaction with care. That's for individuals who are hospitalized. Improve quality of life for individuals who are in long-term care facilities, less unwanted medical care aligned with wishes. So not doing stuff because the individual and their families express those wishes earlier or during the process, and less stress, less of a burden. That's a word that all of you understand. And it's a word that stays with individuals, especially family members, or in this case, surrogate decision makers. Um, and so it's an important topic. It's something that has certainly been highlighted, as we all lived through COVID in 2020 and beyond. And individuals and our family members were perhaps contracted COVID. We weren't able to visit them in a skilled nursing facility in a hospital. ACP came to the forefront. And so it has, experienced a little bit of resurgence. But I'm inviting you to think about this in your own lives and that of your family. Um, and so a big part of ACP is the conversations and the decisions that follow the conversations. Um, Two big parts of it: choosing a healthcare decision maker, and then what matters most to you. So, this title of this presentation is What Matters. And that's actually language that's been framed, and you'll see it a few other times. What really matters most to individuals? And you can see perhaps it goes in line with cultural, religious, or spiritual beliefs, or and then there's a term goals of care. What goals do you have if you are, go back, um, what goals of care might you have if there's a serious illness or injury? This is a picture actually of some ACP training that we do with our students. And so the three students with their mentor, these are all nursing students, we take them through the advanced care planning facilitator training. So when they are working with patients at the bedside or wherever it is, they might not be able to have the time for a full-blown advanced care planning conversation, but they can introduce the idea or remind them of it. So it's something that I'm proud we've been able to infuse into our curriculum as well. And so, as I mentioned before, choosing a healthcare decision maker, in some states, they're referred to as a proxy. In the state of Indiana, they're called a healthcare representative, um, a surrogate decision maker. They mean the same things. That's probably the most important aspect of how this one put. I'd like to show you a short video, which is actually available, and I'll make sure that Jocelyn has the links to these videos. You can share them. They're all YouTube videos, but this one created by the Conversation Project as a humorous way of introducing how individuals should function as your proxy. So let's just let this run.
Be your healthcare proxy? Like if you need someone to tell the doctor what to? I just go with whatever the doctors say. I wouldn't want to bother them. They're so busy. Doctors know best, right?
Be your healthcare proxy? Sure, I'd be happy to. If I'm in town, check out my Instagram pics from Peru. Wish you were here.
Oh, I could never let you go. I can't even throw a plant away. As long as it's got one little green leaf. I'd be like, can't we upload her to the cloud?
Well, heck yeah. I've given this a lot of thought. Let me tell you what decisions you're best off going with. You never let them resuscitate you. And if they even try to hook you up to one of those breathing machines, never. I got this. I totally got this.
How can you even talk about this? I can't, okay? I just can't. Mom, it's not like you're gonna die. No, I can't talk right now.
Oh wait, did I show you that meme from iFunny? The cat and the dishwasher? Oh my gosh, okay. So the cat's like, bleh. And then he's like, wah! Oh wait, sorry, what?
I'm going to just stop it here for a second, play a little bit more. It's a really funny and well done blurb about choosing a healthcare decision maker, but there's a positive side to it as well.
Well, hon, you and I have been through so much together. Here's what we'll do. We'll sit down, we'll get a cup of coffee, and you tell me what matters to you.
Well, it wouldn't be easy. I mean, I'd be sad, but I'd have your back.
I remember when we went through this with Mom, we really spoke for her. So I think I can do that for you. Let's talk about what you would want.
And so I'll just sort of summarize and say, first of all, that YouTube video will be available to you, and feel free to share it. It's a big decision and a little more complicated than most people think. We usually have a sense, perhaps right now, of who knows me best. But this is a little bit further, because I like to make this analogy. I'm a sports person. And the analogy that I use is, if there's a team on the field or on the court, there's also players who are on the bench. And being a decision maker, a proxy, a representative, you're on the bench. But when you're called into the game, you have to be ready to go. If you think about sports, they're ready to go. They've been warming up and everything, but you might be named a proxy. I might be named a representative. And for someone in 10 years from now, I might have to jump into the game. That is very challenging and, quite honestly, not fair for the individual if they're not prepared. So the preparation for a proxy is important. The choosing of the person is really the most important thing. So I'll continue on a little bit more, but if you do have questions about that, I'd love to talk about them after this is done. So the realities of advanced care planning. About 33% of adults in the past 10 years have gone through an advanced care planning process. This is in the United States. It's a pretty low number. It's even lower among minority populations. Um, Between 10 and 20% of adults have discussed any type of wishes with their medical provider, partly because there's time, partly because, quite honestly, most physicians are not equipped to have those conversations. Um, and so it's avoided. And among individuals who have passed away in the ICU, around 20% have had no advanced care planning before they died, and they were in the ICU, so they were very sick. Those numbers aren't really good at all. So it really forces us to say, what other ways can we help our communities and individuals take ownership of advanced care planning? As well, and I think this is not a surprise, the notion of health literacy and understanding healthcare information is a challenge. The average reading level in the United States is the 8th grade. For individuals who are older or perhaps are on Medicaid, it's a little bit lower. And most of these advanced directive documents are written at a much higher level. Now, many of them might come from an attorney's office, which is nice, but not necessary. If it comes from a healthcare system, it's definitely at a higher level. That's not as productive for individuals if they want to really discuss their wishes and share them. And the last part of this is cultural considerations. I think my guess is many of you are in the California region, so we a very diverse state. Non-Western views on autonomy, the ability to make choices and decision makings, don't often conflict with our autonomous society. But 20% of individuals don't want to make their own medical decisions. My family, both my parents are originally from India, and when my mother we were talking, my brother and I, one younger brother, about this with her because I thought, we should really talk to mom about this. I'm supposed to know something about it. And her statement was very clear. And she said, Kevin, I want you and your brother to make my decisions. Now, I like to think she trusted both of us, but she was not interested in deciding anything. So my brother and I made it in conjunction with her, but it sort of surprised me. There's also been quite a bit of mistrust and experiential racism connected to minorities, and the idea of signing a form, especially, and having that form go somewhere is not something that is comes naturally to individuals. And so that really changes the process of advanced care planning for certain individuals. So I'd like to just tell you a little bit about some of the work we've been doing and then share this tool as well. I go back to the term, what matters most to you. This is a toolkit that comes from the Institute for Healthcare Improvement. And it really came out a number of years ago, but solidifies what they call a 4Ms framework. What matters? Issues with medication, with mentation, which is dementia, depression, and delirium, and mobility. So the 4Ms. The fundamental of that is the first, what matters. So what matters most to the person? This is geared towards care of older adults. It's not just advanced care planning, it's all settings. What really matters most to them? So I'll share, there's a reason I put picture of my two dogs on the front slide. I'm a dog person. I suspect many of you are. And it is important for me, because I'm an animal person, dog person, that my dogs are part of my life. And that might change down the road, but it's been this way for a long time. And for many individuals, their pet, their animal is their family. That matters to people if they need to move to another care setting. Or so those types of things are important. It's got nothing to do with the clinical care. It's not to do with what matters to them, just as an example. And so what matters is not so much, and this comes from healthcare professionals, they're interested more so in the treatment. What do you want? What don't you want? But most people, it's not so much what treatment I want or not want, tubes or CPR. It's, am I going to be the same after whatever treatment it is? Am I going to be able to take a walk or speak to my family members? Am I going to, and that's what's most important, the outcome here of this treatment. So it's really about where I'm going to be if I do or don't receive interventions. And so let me share a few things of how we are taking what matters and putting into practice here in Southern Indiana. And it's really through this GWEP grant that I was referring to. A few pictures of individuals. We work with a local healthcare system here called the Deaconess Health System. And this is a picture of one of our care coordinators. You can tell she's wearing a mask, so it was during COVID. And this is in one of the doctor's office in a rural clinic. You can see the sign, what matters to you. Cindy would have advanced care planning conversations, or at least short ones, mainly short ones, with patients who came in for their regular checkup. And so we built it into the primary care visit. This is a team of us, including our lead physician. You'll see him a little bit more, Bill Smith, as we were planning this out. And on the right-hand side is Tracy. She's actually an advanced care planning facilitator. She is a licensed clinical social worker. She's very skilled at having these conversations. She's in her office, and when individuals come in for a Medicare wellness exam, they all meet with her, and they'll have a brief or a long conversation. And it all starts with, have you ever thought about who might be your decision maker? And then tell me a little bit why you chose that person. So we go into more depth in that. And so we're able to build it into the primary care process, but we specifically use a tool. And this is the tool I'd like to introduce. Some of you might have heard about it. It's called Prepare for Your Care. And you can actually just write down or type in prepareforyourcare.org. It is a patient-facing or user-facing website. It was developed about 15 years ago by a team just up the road from San Diego at the University of California, San Francisco, led by Rebecca Sudor, who's a palliative care physician. And Rebecca, we've been fortunate, she's been a consultant for us for 5 years. We've used Prepare extensively. And so it's a step-by-step guide through about 12 video stories. So you can, on your own time, with perhaps a laptop or an iPad, understand the process. There's also a similar site called Prepare for Their Care, which helps proxy decision makers. How am I supposed to really talk to my mom about this if she said, Kevin, I want you to be my decision maker? How do I get that? Because she's not willing to share everything, or as an example, I live 1,000 miles away. I was a long distance caregiver to my mother, and that is just a reality that's not going to change. And many of you, I suspect, have family across the country. So Prepare for Your Care was something that we introduced in our work. We also introduced this to all of our students. Our students actually go through an ACP process and create an advance directive. This is the example of the Indiana Advance Directive. So the Advance Directive is a document, but when you go on the Prepare site, you can complete one for any state, and it fully meets the legal requirements of your state. Now, this is the most extensive Advance Directive I've ever seen in my life. I like it because, quite honestly, it's in color and it has pictures. but that's the stuff that most people understand, and I think it's really valuable. It is free to use, and I really would recommend you engaging in it. And so Prepare here allows you, there's 5 steps to the Prepare program, from choosing a medical decision maker to how do I even talk to my physician about certain things? I'm not confident. B, I can't get an appointment for a while. How do I do that? This really helps guide you through examples. It doesn't necessarily answer everything, but it's an excellent start. And quite honestly, if you are able to choose and then really have conversations with your medical decision maker, your proxy, then you have gone through a wonderful amount of advanced care planning. You don't have to do all of it. And for those of you who know of people or maybe yourself who really, because our lives are complicated, might not be able to think about a proxy, you can go through the other stuff. You don't necessarily have to be bent on the advanced care planning proxy part. So I'd like to share with you a short video. Again, my dogs at Christmas time, this is what they do. And the short video really sort of explains the process that we've been going through. So I'm going to just bring up one other document here and show you a short video about that as I sort of come to the conclusion of my talking, because I think I talk too much anyway. So this video will explain a little bit how we've engaged in advanced care planning here in Southern Indiana with the Deaconess Clinic. You'll see a few other people there, how we've brought it in. You'll hear Prepare a little bit more. But again, we invite, and I'm using that word a lot because it's an invitation. Quite honestly, people like invitations. And so we're not forcing people to do it, but we've had a lot of people, probably at least 80% of individuals say, this is something I want to do. Advanced care planning is a process. It's a process of reflection, understanding, and then discussion and dissemination. So that's really a official definition, but it's really about engaging individuals in terms of what matters to them.
When I talk about advanced care planning with patients, and it hopefully the patient still has capacity to make their own decisions. That's the first thing. Try to frame it in the context of what their wishes would be should they not be able to make their own medical decisions, and try to explain to them that there is likely going to come a point in their life when somebody else will make those decisions for them. And so it's important to know that in advance and have that documented, and for me to understand what their wishes would be so that I could carry them out for them or make sure that they do get carried out.
And so we are touching individuals' lives through an invitation. It's an invitation that first comes through a letter from a patient's physician, and then a phone call, and then it's wrapped into a patient appointment. Physicians discuss it during the patient appointment. Our ACP facilitator engages individuals, and there's follow-up as necessary. So it's many different parts in the advanced care planning process that we've been able to co-create, revise, change at all of the Deaconess locations that we're working in.
Advanced care planning is important for patients to have in place before an illness such as dementia robs them of the decision capacity to make their own decisions. If their illness progresses to the point where they can't make those decisions, then the family is left to decide for the patient, unfortunately. And families really struggle to figure out what exactly to do.
From the healthcare system's perspective, advanced care planning, the benefits of advanced care planning are numerous. It helps providers like Bill Smith to be able to engage his patients in a very deep and profound way.
You know, at the end of life, taking care of a patient, if we don't really understand what their wishes are, it is a struggle for healthcare providers to really understand what to do. How much care should we be providing?
The patient or the person is involved in their own healthcare. They're not just receiving healthcare, they're engaged in it. So there's shared decision making, which is a big part of what healthcare should be. I want to be involved in my decision making, not just receive advice from my doctors.
So in my office, we use Prepare for Your Care, and this is a program where patients can do this ahead of time. It's a brochure. I've gone through the program, my wife has gone through the program, so I'm better able and prepared myself to be able to talk to patients when they get to my office. Sometimes the patients have not gone through this, and I present them with Prepare for Your Care, and it's a way for patients to think about advanced care planning. It gives them some videos to watch, and then if they answer the questions, by the time the program completes, they'll have an advanced care plan in place.
So I'm going to stop sharing that, but I'll just sort of conclude and say that a really great tool to use, and there's a number of them. The Conversation Project has one. There's Prepare, I sort of found, because we've been working with it for about 6 years now, is very easy. It is translated into 10 languages. It's something you can start and stop, which most people have to do. And then you can share it. You can share it with your doctor, maybe ask follow-up questions. Bring it to an appointment and say, I completed this. Can we talk about this? But it can also be shared with others, children, family. We have a final, part to this, that what do you do with this stuff? Years ago, when I was very proud of developing my first advanced directive, I put it in a safety deposit box in a bank, which I'm not even sure people use anymore, but it stayed there for 17 years. And of course, it was useless there. I even lost the key to the safety deposit box. So if anyone would have needed it, it would have been irretrievable. When I went through Prepare myself and shared it with family and friends, and even my kids, it's also on my refrigerator, hanging up right next to pictures, and that's very practical because we put stuff on our fridge. But if the EMS and emergency services have to come, they'll grab something from my fridge and take it with them. So it's also very practical. So I'm going to stop talking right there. I hope the videos came out clearly, and as I said, I'll share them with Jocelyn, and she can certainly share them with everyone. They're just YouTube videos, and feel free to use them and check out Prepare. So thank you.
Thank you, Dr. Valadares. That was really interesting information, I think, and also to see the tools that are available to make it a practical approach and to make sure it's a thorough conversation. I want to open up the floor if anybody has any questions here. I didn't see anything in the chat quite yet. I did want to ask, Kevin, and in your research, what have you found have been some of the common misconceptions or like biggest challenges for patients and doctors when they're trying to do advanced care planning?
Well, I think, a number of them. One is, one of my first slides said advanced care planning is for all adults. And oftentimes we don't necessarily, in fact, most of the time, these conversations only occur in a time of crisis. And so I serve on an ethics committee at one of our regional hospitals. We talk about this all the time because it's a real time, but also families are complicated. And so, it's always better to have those conversations earlier. I facilitated a number of these. I think you saw the video where the woman says, we'll sit down and have a cup of coffee. I'm a big coffee person. I've consumed gallons of coffee in people's kitchens, but it's where they're most comfortable. I'd rather have parts of these conversations in a much more relaxed state than in the emergency department or the ICU. So, but it's also a time where it's hard because there might be a disagreement, even though it's up to the person. I will tell you, my brother and I were very surprised when our mom said, "You guys decide." We're like, "Whoa, excuse me." Um, she was fully able to, but it was her choice, and we wanted to respect that choice. So I think there's no better time like the present to at least start and check it out.
Another thing I really liked that you shared was that tool that sort of broke down all the different, like what is dialysis and this type of thing. I feel like a lot of times when people are going through advanced directives, they don't often, when you explain intubation or, artificial nutrition, people don't always understand what that means, and their perception of what they want and don't want doesn't always align. So that's a very great tool in layman's terms.
It's a great tool, and I would probably say that again, I'll say this a few times, the best advanced care planning is two parts, really finding a decision maker, if that's possible, and then what matters to you. And they go hand in hand. You don't have to have everything perfect because life isn't perfect. Um, so starting with one is better than and saying, well, there's no one in my life right now. I'll just give you one example because I can actually see some questions.
Oh, good. Okay.
If that's okay. How often should you review and revise your healthcare directive? It's a great question. And so, really, so I'm holding up 5 fingers here. The common notage is sort of the 5 Ds. And if there is, so once every 5 years, uh, unless there is a death, let's say a death in the family. And that, when a loved one passes away, it naturally causes all of us to look at our own lives, especially if that person was close, but it could be a close friend. But that might be a time to look at your own wishes as well or revise them. If there's a divorce and your healthcare proxy was your spouse, uh, that's a time. If there is a diagnosis or a serious illness, so there's about 5. um, it should be revised as your life changes, as your health and your life changes. So that's a great question. Keeping it in a safety deposit box for 17 years is not a good strategy. So another question, what would you recommend for people who have no living family members or suitable friends to be their decision makers? It's an excellent question. We work with a small community close to here in Evansville called New Harmony, Indiana. It's a retirement community. And in that community, that question is exacerbated a lot. They don't have family members living close by. They have friends, but they might not be deep friends. I'll tell you what happened when we started introducing this in New Harmony, that many individuals found that their loved ones who were far away, or usually adult children, might not be the best individuals to be the decision maker. They would still be involved in decisions, but the decision maker, let's say, is like a spokesperson. That could be a neighbor. We have many individuals in New Harmony who trusted a neighbor. The neighbor, they elected them to be the spokesperson because they're not going to be as emotionally involved in if someone has a stroke and is in the ICU. The family members would still be there and be very emotional. However, if there's nobody, then it's probably important to note that you don't have to choose somebody. It'd be ideal. Go to what matters most to you. Complete that. Share that with physicians. Share that with even a pastor or anyone else. So at least your wishes are known. What happens if one of the wishes is assisted death and it might not be legal in the area where the person resides? Great question. It is totally illegal, any type of medical aid for dying in the state of Indiana. So that really is something that if one of the wishes now, having a medical aid for dying, physician-assisted suicide is a slightly different process. Um, but of course, if it's not legal in the state, then it won't happen. And so planning that in advance, which has to be planned quite a bit in advance, because you have to usually be a resident of a state to be able to do that. California is an example, is important as well. But that can be, certainly written into the advance directive. One of the latest advance directives that I wasn't really a part of the facilitation is I read for an individual who at a certain point he decided that if he was unable to make decisions for himself, and this gentleman had progressive type of cancer, he didn't want any food or water. He wasn't interested in starving or being dehydrated. He wanted to be kept comfortable, perhaps with ice chips or something, but he wasn't interested certain in a tube or anything artificial nutrition hydration. Come to find out, I believe it was his mother had gone through that, and it was a very hard thing for her. She wasn't able to express those wishes, but then the family. So he put that right in the advance directive. It was appropriate because of his cancer diagnosis. Might not be as relevant for you and I because we're not there yet. So you can be as specific or as general as you want. I think more important is the conversation. And quite honestly, in most states, you don't really even need an official form. Now, the official form helps, especially because hospitals like official forms, and maybe judges do too, but you can use a napkin. Say, I, Kevin, don't want this, and I would like Jocelyn to be my decision maker. That's good. At least there was some communication.
Okay, any other questions? All right, Dr. Valadares, thank you so much for joining us today. We sincerely appreciate it.
Absolutely.
I'm sorry. And thank you all for joining us as well. We have a couple exciting webinars lined up for September and October. So you'll be getting a little bit of information about those in our follow-up email. And we hope to see you all next month.
Okay, thank you so much, both to Jocelyn and Michelle, and to all of you for participating. Check out the Prepare for Your Care website, easy to find, and I'll make sure that the videos go to Jocelyn, and I'm sure it'll be available too. So
absolutely, we can share those links in the email, and we can also share those on our website when we post this webinar.
cool.
All right.
Okay.
Thank you.